Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
How many times have you taken your pets to the vet with basic issues, but you find you're hesitant to ask them certain other questions about your pet's health? On today's show, we will give you that opportunity to address those important questions. And as always, we are here to answer all of your questions. All that and more coming up on this episode of Ask the Doc, No Appointment Needed. Hello and welcome to Ask the Doc, No Appointment Needed, the show where the questions you send in are answered by our medical professionals. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and thank you so much for joining us today. This is going to be a really fun episode, so let's get right to your questions, guys. All right, so the first question comes from Donna, and she emailed us. Hi, Doc. I told my friend I'm thinking about getting my indoor cat declawed and possibly even getting my dog's ears cropped. She looked at me like I was crazy. What do you think about having either one or both of those procedures done? All right, Donna. So let's start about the declawing first, okay? So there definitely is a lot of controversy with getting your cat declawed. Technically, when you get your cat declawed, you are removing the very distal part, the very end part of their toe, or basically the digit. The nail is attached to the bone, and the only way to remove that nail is removing that part of the bone. So yes, it definitely can be a painful procedure. Now, I have declawed cats and I have declawed my own cats. Okay. I try to get owners away from declawing cats, but if there is no other solution, if it's basically they're going to either give up the cat or the cat's going to become an outdoor cat, I would much rather have an indoor cat that is declawed than an outdoor cat that is not, okay? Because outdoor cats, unfortunately, there are a lot of things that are outside that they can get in trouble with. Now, okay, so if that is your situation, you want to find a veterinarian who knows how to do a declaw. This is not the time to try and save a penny, save a buck, okay? It's not crazy expensive to get them declawed, but it's not the cheapest thing either. The reason why is because, it is a big surgical procedure, and there definitely can be a lot of complications if it is not done correctly, okay? Because you are basically removing that end part of the bone. Now, good thing is there are a lot of newer pain control and pain options out there to help make it less painful for your cat. There's a new, what's called a liposomal buprenorphine. Basically, it is an injection that you put into the tissues or into that area, and it numbs the area for up to 3 days. Sorry, it's actually bupivacaine, which is a numbing agent. It works very good. A lot of times you can do what's called nerve blocks or ring blocks that will numb the paws, and you can use that Nocita, and that will last for 3 days. There are definitely a lot of other pain control options, as far as hydromorphone, fentanyl, different things like that, as far as for pre-op and post-op to help make things, not be too painful. The bad thing I will say is that most of the time the paws do have to be bandaged for a certain time period. Cats do not do well with bandages, okay? They're going to flick their paws and try and get them off. And the next thing you know, they've taken their bandage off and then they're bleeding all over your house and then you're freaking out. It does happen. It doesn't mean they're going to bleed to death, okay? But it can be a big mess and it can be very frightening. So definitely there are some problems that can happen post-op. I have seen some kind of botched, I guess if you say declaws, that, basically had to go back in and kind of redo and stuff like that. Thankfully, I have not seen any declaws where the leg had to be amputated, but I'm sure there are cases of that out there. Okay. So if you first need to explore all your options. Okay. Scratching post, those little nail things that they put on their claws, different things like that. If you explored those options and it is not working, and you're like, hey, I'm either going to have to get rid of my cat or keep my cat outside, then yes, okay, I am okay with a person declawing. All right. Other vets may feel differently, but that is my personal opinion. Now, let's get to the second question. So, as far as ear cropping goes, I definitely do not recommend it. Okay. It is 100% solely a cosmetic procedure that is unnecessary. And the thing is I don't even know how to crop ears. Okay. They don't even teach that to us in vet school. Some of the older veterinarians may know how to do it, but I have absolutely no clue. So, if you come to me, I want to be like, I don't know how to do it. I'm not going to mess up your dog's ears. And there definitely are a lot of complications. Just because you get their ears cropped doesn't mean they're going to stand up straight. Sometimes you may have one ear that's up and then one ear that's kind of flopping like this. It sometimes happens, so all this money that you spent and for this dog to go through this procedure to have, what you thought was going to be beautiful, pointy, short ears, it doesn't end up happening. I have definitely seen quite a few kind of cruelty cases, unfortunately, where certain people have cropped their dog or puppy's ears at home, like literally without anesthesia, pain meds. I don't even know what they use. I guess a knife or scissors or something. I had a very small puppy that came in that basically had to get a blood transfusion because someone cropped his ears, and it was not a veterinarian, and he literally almost bled to death. Thankfully, he made it, but it was definitely, it was such a sad case. So as far as cropping your dog's ears, don't do it. No one needs to do it. Floppy ears are in and they're always going to be in on them. All right. So hopefully this helps you make a little bit better decision. Okay. All right. So the next question is going to come from Andres. Hi, doc. My question deals with flea, tick, and heartworm prevention medications. Is it really necessary? I feel like it's a way for my vet to make extra money. All right, Andres. Yes. Okay, listen. As far as all those preventatives, I don't know of really any veterinarian office. We are not getting rich off of it. Okay. It is marked up. Okay. But it is barely marked up. All right. So your vet is not making bukus of money because of the prevention. The reason why vets promote the prevention so much is because we see all the bad things that happen when your pet is not on prevention. Okay. So take this, for example. Yesterday, I had a dog come in. Owner complains, my dog is itching all over the place, is scratching his paws. I can't sleep at night. The dog can't sleep at night. I asked the owner, I said, hey, do you have him on flea prevention? No, but he doesn't really go outside that much. Okay. All right. First thing I do, start looking for fleas. Guess what? I found not one flea, not two fleas, but a bunch of fleas. He had very dark fur, so the owner was not able to really see it. There was a problem right there. Then the owner also told me that her daughter's been having an allergic reaction and they were thinking that she was getting bit by something and they didn't know. I don't know for sure, but I'm guessing maybe it could be the fleas. All right. So fleas definitely can cause a problem. Same thing with ticks. These guys, we've talked about it on other episodes. There are a lot of flea and tick-borne diseases that can be deadly if they are not treated. Okay. Sometimes they don't cause any problems, but they certainly can. Same thing with heartworm prevention. Okay. There are mosquitoes everywhere in South Florida. Okay. It rarely gets cold enough for fleas, ticks, mosquitoes, any of those bugs to die. Okay. So they need to be on prevention all year round. If your pet gets heartworm disease, it can be fatal if it goes a very long time with being untreated. And the treatment is expensive and the treatment is dangerous. There are definitely cases where a pet has had an anaphylactic type reaction to the injection to kill the adult heartworms and the pet has died. Why even risk it with your dog when you can get prevention easily? Okay. Prevention is not that super expensive. All right. You can purchase it online. You can get it from your veterinarian. I mean, there's tons of ways to get it. And it's just part of being a responsible pet owner, guys. Listen, if you don't have the money to be able to take care of your pet, the way it should be, I hate to say it, guys, but don't get a pet. Okay. There are definitely, you can foster, you can volunteer at animal services. You can go to the shelter. You can be with a pet and spend time with a pet without personally owning it. Okay. It's not fair for your pet to not get the proper care just because you say, hey, you know what? I just want a dog, even though I can't really take care of it. Okay. So yes, Andres, it is not a gimmick. Okay. We are not making bukus a buck off these preventions. The good thing is the preventions are usually fairly affordable. Okay. And also, there is a lot of preventions out there. There's injections that can last 6 to 12 months for heartworm. I heard there's a new injection for fleas and ticks that lasts, I think, for up to a year. There's like topical medications that last for 3 months. There's oral medications that take care of everything: heartworms, fleas, ticks, intestinal parasites, you name it. We've got a lot of products out there, and they are safe, guys. So that's another question. All right, Andres, I'm going to get off my soapbox for now, but hopefully you go to your vet and you get you some prevention, okay? All right. So our next question comes from Annabelle. All right. I wanted to adopt a pet from our local animal services, but my friend says conditions and treatment there is not good. What do you think about this? All right, Annabelle. So there has been a lot of controversy recently within the last couple of weeks about animal services. All right. This is my personal thoughts on it. All right. So unfortunately, the main shelter that we have in Doral, as far as for Miami-Dade, is full. It is at capacity, but there are still dogs that are being surrendered. Okay. Because of that, they have had to move some of those dogs to the old shelter, which I think is in Medley, somewhere else in Miami-Dade County. That old shelter is an open air facility that does not have AC. Now, it is supposed to be built to where a breeze can come in, and they're supposed to have fans and other things like that. It's definitely not ideal. It is hot. I know that. It is not ideal for these dogs to be in that shelter, but there is no other option unless they euthanize. Okay. So yes, you need to, if you're looking for a pet, anyone out there, the first place you need to go is to animal services. Okay. A lot of people are posting online. They're crying out loud saying, we need to do this. We need to do that. We need to contact the government. We need to contact the director of animal services. And that's all good and well. But at the end of the day, we need to get these pets adopted. We need to educate people to stop dumping their pets. We need to educate people to spay and neuter their pets. If we don't stop this problem at the root, it is never going to be solved. Okay. And why I hate that these dogs are in the condition that they are over at the other shelter, I think honestly, it's better than them being euthanized. Okay. I will say this much. I do know some people that work for animal services, and they do care about the animals. While there are some bad apples in any profession and any business, okay, I would like to say the majority of people that work for animal services do it for the animals. Because trust me, they see a lot worse things than probably I do on a daily basis. Okay. They have to deal with criticism from people from everywhere, from online, things like that. Social media is just completely blown up. When anybody can get on the keyboard or the computer, I should say, and be what you call like a keyboard warrior and just type things that are not necessarily true. So there is a lot of misinformation that is out there, but I definitely do believe, that animal services is trying to do the best that they can, what they have as far as within their budget and what they have is within their facility. All right. So Annabelle, go to animal services. Please look for a dog. If you don't think you can maybe make it a forever home, even just fostering. Typically with foster, I don't know the whole protocol, but usually as far as medical care and other things like that, they will help you out while you foster this dog until they can find a forever home. Because like I said, until we address this root problem, and that is people just dumping dogs, backyard breeders, people not spaying, neutering their pets, this is never going to be solved. Okay. All right. All right. We just got a question from Pat, this time from our Facebook page. Hi, Doc. My dog got into some chocolate the other day, so I took him to the ER, and thankfully he's okay. I may or may not have given him some other people foods, but this scared me. Is it okay to give him some people food? If so, what food should I stay away from giving him? And what should I do if I see he gets into something that he shouldn't? All right, Pat. So I'm very happy your dog is okay. All right. Definitely. We do see a lot of pets that eat chocolate. Okay. Majority of the time with chocolate toxicity, unless it is like dark chocolate or like cocoa powder, and it's a very small dog. Thankfully, it usually is not fatal. Honestly, I just tell people just stay away from human foods with your dog. Okay. Unless it's some like plain chicken, white rice, cottage cheese, things like that. Maybe your vet might recommend, for a bland diet if they're having some GI issues, is not really needed. If you are dead set on like, hey, I want to give my dog some people food, you got to be prepared that some dogs can handle people food and some dogs can't. And the dogs that can't handle the people food are the ones that I see in the ER. They get pancreatitis, they get what's called hemorrhagic gastroenteritis. They can come in and they can be very sick. So I honestly say it's just better safe than sorry. Obviously, as far as foods to avoid, I think we have talked about this on some other episodes, but things, obviously chocolate is a big one. Onions, garlic, anything that is really fatty can obviously be very bad for them. It's just, think about it. If it's not something that you would feed, I guess maybe it's something if you wouldn't feed a baby, like then I wouldn't give it to your dog kind of type of thing. Like you don't want your kid or your baby eating a bunch of junk food. Okay. If you want to give them a little piece of bread, have I done it? 100% I have. Probably not going to cause any issues, but better safe than sorry, Pat. Just stay away from the human food. There are plenty of treats out there that are made for dogs that, trust me, are just as yummy as any people food that your pet will be perfectly fine with. Okay. So, all right. So don't give him any more people food and hopefully no more chocolate, Pat. Okay. All right. Dave followed up with his email and he writes, our baby is now 11 years old, and when we were at the vet, we were told his teeth were so bad he needs a dental cleaning, but under anesthesia. Is that a regular procedure? I'm a nervous doggy daddy who is worried about putting him under. Are there any other options? All right, Dave. So if your vet said that he needs to get his teeth cleaned and your vet said that they're bad, he probably needs to get his teeth cleaned. Okay. All right. I see horrible dental disease like every single day. Yeah. And people are like, oh my God, why does my dog's breath smell? It's because their teeth are rotten. I have to say it in a nicer way, but that is what I am thinking. Okay. So yes, don't worry about the anesthesia part so much. Okay. Your veterinarian or most veterinarians, I say, are more than qualified to be able to pick an anesthetic protocol that is going to be safe for your pet. There is always a slight risk when you put a pet, when you put a person, when you put anyone under anesthesia, okay? But those risks can be very, very, very minimal if the proper protocol is followed, okay? And yeah, unfortunately, if their teeth are so bad that they've got to possibly do some extractions, things like that, there is something called a non-anesthetic dental, but that's not going to cut it if your dog's teeth are that bad. I'm not the biggest fan of non-anesthetic dentals. Have I done one on my own dog? Yes, I did. I wrapped her up in a towel, which is what they typically do. And they do it and calmly and try and safely. And I've taken a little scaler, like a handheld, and I've literally scraped the tartar off of her teeth. But there's only so much you can do that way. Okay. Thankfully, most humans' teeth don't get that bad. And that's why when you go to the dentist, they can use kind of like the hand scaler to be able to get the tartar and calculus off. But unfortunately, in a lot of dogs, the periodontal disease is too bad. It's to the point to where, you can't just do that. They need to be put under anesthesia. And trust me, I have seen a lot of problems when they have severe periodontal disease. Good case, an example is I had a dog last week whose teeth were literally rotting out of his mouth. And because of that, his jaw right there actually fractured. I had to go in and I had to take some surgical wire and I had to basically wire part of his jaw back together. And the reason why it broke is because of the dental disease. It had eaten away at the bone at the jaw and it literally broke his jaw. Okay. So there can be some really bad consequences if they do have really bad periodontal disease. So Dave, listen, don't be scared. Talk to your vet about your concerns though. They will listen to you. They should reassure you and make you feel better, but get your dog's teeth cleaned. Okay. All right. All right. So Nicole emailed us in and she has a question many of us can relate to. All right. Hi, Dr. Joy. What is the real deal with vaccines? I am not anti-vaccine, but I don't know if they are all necessary. especially since our dog is inside 90% of the time. Are these just ways to make money, or are they important for our doggy's health? All right, Nicole. Yes, 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 they are important. Trust me, the vaccines, they're not making bukus of money off the vaccines, okay? Once again, even if your dog is mostly indoors, there is still always a chance for them to get some of these diseases that we vaccinate for. And rabies, pretty much 100% deadly, okay? So don't even risk it. It's a very safe vaccine. The vaccine has been given for years and years and years. Actually, as a human, you can get vaccinated against rabies. I'm vaccinated. Not the same vaccine as the dogs, though, but I am protected. So yes, definitely rabies. Okay. Things like what we call the DHPP vaccine, which is the distemper, the hepatitis, the parainfluenza, the parvo, the kind of like 4-in-1 vaccine. That is definitely necessary too. Distemper is out there. Distemper can be deadly. It can cause severe neurological signs. Your pet can go into a coma and never wake up, and you have to euthanize. They can have long-lasting neurological side effects. Okay, same thing with parvovirus. Parvovirus. I have seen so many puppies that have died from parvovirus. Thankfully, now we've got some newer treatment options out there that they're having a better outcome. But I have definitely seen plenty of puppies die from parvovirus, and it is out there in the environment. You can bring it in on yourself. You can be walking around your neighborhood and some dog poops somewhere that had these viruses, gets on your shoe microscopically. You come inside your house, you wipe your feet off on your doormat, you take your shoes off. Later on, your dog comes around, is sniffing, licking things, stuff like that. So even if your pet is mostly indoors, vaccines are still important. Okay. A lot of veterinarians are offering kind of what we call 3-year vaccines. So if you're like, listen, I don't want to vaccinate my pet every year, express those concerns to your veterinarian and talk to him or her, because there are some vaccines that can be done every 3 years. You can certainly get titers done. You can make sure that your pet has enough antibody levels to protect them against some diseases. And yeah, you could push the vaccines back a little bit more. The thing is doing titers, it can be expensive. It is a lot less expensive to vaccinate them, and vaccines have proven to be safe and effective in animals with very minimal risk and side effects. All right, Nicole. So yes, vaccines are needed. Go get your pets vaccinated, guys. All right. I think we got time for maybe one more question. Let's see. All right. This is from Erlina, and she reached out to us through Instagram. All right. My abuela says I need to wait to get our new kitty spayed. Why should I wait? And how long should it be before I get her spayed? All right. So abuela, kind of yes. Maybe a little bit right, maybe not. Right. Depends on how old your cat is. Okay. I typically recommend for cats, if they are over the age of 6 months, and as long as they're a good body weight, let's say around 4 to 5 pounds, okay, they can get spayed. All right. Cats, go into heat, and they can go into heat pretty early. All right. And when they go into heat, it is the most annoying thing ever. And they are what we call induced ovulators, which means, they ovulate when the male's around. So they just kind of keep going in and out of heat, like every month and a half, unlike dogs who normally have 1, maybe 2 heats the most a year. Also, too, cats can get pregnant very easily. Trust me. You may say your cat is indoors, is never going to get out. Next thing you know, your indoor cat who's not spayed gets out. Trust me, if it's out for a long enough time period, she's coming back knocked up. Okay. So you want to definitely prevent it. All right. They don't need to have their first period. There's really no benefit in that. And that's the same thing when it comes to dogs. I hear so many times, oh, I want to wait until my dog has a litter of puppies. That's what my mom says. I want to wait until she's had her first period. We are recommending with some of the larger breed dogs, maybe to get them spayed a little bit later, but I still do believe in getting them spayed before the first period, because there definitely are a lot of benefits. It reduces the risk of developing mammary cancer like substantially. Okay. So, like you said, Erlina, if your cat's 3 months, yes, it's too young to get spayed. So your grandma is right. But if you got a cat that's over 6 months old, girl, get her spayed. If she hasn't had her first heat, she's going to go into it very soon. And I promise me, you're going to be regretting it, because they are going to be very, very annoyed. Okay. All right. So we've had some great questions so far. So keep those questions coming in and stuff. All right, guys. And let me see. I don't think I'm going to have time for the last question, but let's just kind of recap on kind of what we talked about and things. Okay. So listen, one thing I want to say is do not be scared, guys, to ask your vet the important questions. Okay. We are not here to judge you. All right. We are here to educate you. We are here to help you out. We are here to help you make the best decision. And we want to guide you in the way that needs to be done. Okay. No question is really off limits. Okay. We might later on go to the back office and say, that was an interesting question, but you know what? I would much rather have a person who has a question, who has a concern about their pet to ask me, rather than getting information online. The reason why is there is so much misinformation online, guys. Anybody can put up a podcast. Anybody can make a video and put it on YouTube. Anybody can post anything. And you have to, you can't trust all those people. Some people are legit, okay? But trust me, us veterinarians, we have spent at least 8 years, if not more, at education. And then when we get out, practicing to be able to educate you guys, all right? So we're not trying to give you misinformation. So please believe your vet and listen to your vet, all right, guys? So thanks so much for joining me today. This was a really great show, and I hope to see you guys next week, all right? Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.